if you look at caregivers of Alzheimer's patients, when you give Alzheimer's caregivers the flu shot, there's supposed to be an antibody response. The reason we give you the flu shot is that we give you a viral particle to which your immune system is to make an antibody, which will then fight the flu. And out of 100 people, if you give them the flu shot, 80 of them should mount a good immune response. Amongst Alzheimer's caregivers, only 20 out of 100 will. So their immunity is suppressed. If you wound Alzheimer's caregivers, on the average, their wounds take several days longer to heal than that of non-caregivers. So that here we're talking about, on the one hand, we're talking about the importance of caregiving and nurturing and so on. And then I'm saying that chronic caregiving actually can suppress the immune system. So how do we resolve that dilemma? Well, the dilemma is resolved by realizing that it's not the caregiving per se that creates the problem. It's how we provide that care. And who are we in the process? And in the process of caregiving, do we also give care to ourselves?